Welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the session or topic for the day is supervision. Supervision is an important topic both in community health nursing and nursing administration or nursing service management and education. So you can use the same content even in community health nursing and nursing administration with slight changes or modification in the context of the subject either in community or nursing administration. I am mainly focusing the topic into the community health nursing in this video. I have covered the maximum content and maximum areas of the topic of supervision. So I would like to make three parts because it is very broad, very vast, and because it is an important topic in both the community health nursing and administration. Then part A consists of introduction, which includes the concept of supervision, nature of supervision, meaning of supervision. Then I have included three definitions of supervision in this video. Then goals of supervision, objective of supervision, types of supervision, methods of supervision, techniques of supervision, tools of supervision, and steps of supervision. So these are the content I include in this today's video, that is part 1A session. You can just understand that part 1B will be the video I have already uploaded, that is principles of supervision with the mnemonic. Then in the second part I will include a supervision criteria, that is criteria for supervision, essential qualities of a supervisor, then factors of effective supervision, factors influencing effective supervision, functions of supervision, functions of a supervisor, duties and responsibilities of a supervisor, advantages of supervision and disadvantages of supervision. So these are the content I will include in the part 2 supervision. Then we have one more part, that is part 3 supervision, that is an important short note in community health nursing, that is supervisory responsibility of a community health nurse in either primary health center or in primary health care. So supervisory responsibility of the community health nurse in primary health center or primary health care level. Or they may ask a supervisory responsibility of the community health nurse. That would be the third part video of supervision. So let us start with the video for part 1A session, that is basic or introductory part of supervision. First is introduction. There is an old saying that which is not inspected is not done. So whatever activities or whatever services has been done has to be able to inspect by someone, either to check the activity whether it is done in a correct way or in a quality way, etc. So an old saying says that which is not inspected is not done. So if the activity or services cannot be inspected by someone, and that should not be done. This is the concept of beginning of supervision. Thus any activities of the organization or institution has to be inspected. Hence inspection, overseeing and supervision arise in response to the need inherent of the functioning of an organization or functioning of an institution or health infrastructure. So health institution in response to the need to run quality services to the citizen or to the people, the activities of the each worker or health personnel has to be inspected, overseen and supervised by the senior person or the worker or employee. Now let us see the concept of supervision. The word supervision is derived from two words. So supervision is derived from two words, that is super and vision. Super and vision. Super means above or over. Super means above or over, and vision means to see, visualize. Vision means see. Thus, in short, the meaning of supervision is overseeing. Literally, this can be meant as a bird's view. Always a bird will view from the top to the bottom. So supervision is the bird views. Or supervision is an inspection. It is an inspection that is oversee the subordinate or employee at work by the senior health personnel. So supervision is the inspection or oversee the subordinate or the employees or workers at work by the senior person or by the senior health worker. In practical sense, in the function of the both male health worker and female health worker at subcenter is supervised by the health assistant male and health assistant female respectively. Now let us see the nature of supervision. The term supervision earlier conceived or meant only for inspecting and finding fault among the workers or among the employees. So in a previous concept, supervision means it was just inspecting and finding fault of the workers, especially health workers by the senior health worker. Then later it is proved that supervision is much more than that inspection. It is not only inspection, but it has a broad scope. That means now the modern concept of supervision is to guide and help the subordinates in their work by giving training, by educating them, and by giving guidance and counseling. Thus, in modern concept, supervision means to guide, help the subordinates in their work or at their work by giving the training, by educating and guiding and counseling the workers. So, in short, supervision includes inspection of another work, evaluation of another performance, and approving or correcting the performance of the employees. So, supervision includes inspecting, evaluating, and approving or correcting the performance of the or activities of the workers. Now you know something about the supervision. Now let us see the meaning of the term supervision. Supervision means observe, guide, and modify. So in short, all these three comes under supervise. So supervision means observe, guide, and modify the activity or works of the employees. Thus, it is primarily concerned with overseeing or watching the performance of the workers or the subordinates at work under his control. So it is primarily concerned with supervising or watching the performance of the employees or workers or the subordinates at work under his control. So one supervisor usually may supervise minimum 10 subordinates. In another point of view, supervision is an educational process. Supervision is an educational process in which the person with the better training and experience takes the responsibility of training the persons with less training and experience. So, in another meaning, supervision is an educational process in which a person, senior person with a better training or more training and experience take the responsibility to supervise the subordinate. That is giving training a person with less training and less experience in the work setting. Then supervision also means that it is a process. Supervision is a process of both helping and enabling a cooperative relationship or coordination between the supervisor and supervisee or the supervised. So supervision is a process of helping and enabling a cooperative relationship between the supervisor and supervisees or the supervised workers. Next is the definition of supervision. So according to Williamson, supervision is the process. According to Williamson, supervision is a process by which the workers are helped by a designated staff member or staff worker. So, supervision is a process by which the workers are or employees are helped by a designated staff member to learn according to their needs, to make best use of their knowledge and skills. So, to make best use of the knowledge and skills of the employees. Thus, to improve their abilities or skills so that they do their job more effectively and with the increasing satisfaction to themselves and the agency or organization or institutions. So, according to Williamson, supervision is the process by which the workers are helped by a designated staff member to learn according to their needs of the institution, to make best use of their knowledge and skills. So, maximum utilization of their knowledge and skills and to improve their abilities or skills so that they do their job or they do the service or activities more effectively to achieve the quality and with the increasing job satisfaction and with increasing satisfaction to themselves and to the agency. So, the agency can achieve the goals and objectives with a more systematic and cooperative and coordinated way. The second definition is according to Terry. According to Terry, supervision is observing the subordinates at work to ensure that they are working according to the plans and policies of the organization or institution and to help them in solving the problems which come across during the activities or service. So, according to Terry, supervision is observing the subordinates at work by the supervisor to ensure that or make sure that they are working according to the plans and policy. Each organization or healthcare institution has set plans and policies. All the workers has to render the services according to the plans and policies of the institution or organization. So, supervisor ensure that the workers are doing according to the plans and policies of the organization. And he also help the employees or workers to solve their problems. The problems which come across during their services or activities and help them in solving their problems. So according to Terry, supervision is observing the subordinates at work to ensure that they are working according to the plans and policies of the institution or organization and to help them in solving the problems. Then the third definition is according to Terry and Franklin. According to Terry and Franklin, supervision is guiding and directing the efforts of employees. It is a guiding and directing of the efforts of employees and other resources in the institution to accomplish the stated work aspect objectives, to fulfill the stated objectives of the organization or institutions. So according to Terry and Franklin, supervision is guiding and directing all the works or efforts of the employees and other resources in the institution or organization to accomplish, to fulfill the stated work aspect, objectives and goals of the institution. So that is about the definitions of supervision. So now you understood what you mean by supervision, the concept, the nature of supervision, the meaning of supervision and the definitions of supervision. Next is the principles of supervision. I have already uploaded a video of principles of supervision, that is mnemonic of principles of supervision. You can go through that, or I will give the link into the card, so you can search for that. So I have made a mnemonic for the principles of supervision as same like principles of supervision, principles So please go through the video of principles of supervision and you can understand easily about the principles of supervision. These principles of supervision you can apply both in community health nursing and even in management of nursing service education or in administration, nursing administration also. So this is a table what I have made in that video, that is principles of supervision. So please go through that. Then next is goals of supervision. What are the different goals of supervision? There are mainly important 8 goals. There are mainly 8 important goals of supervision. First one is to bring or develop the personal and professional growth among the employees. So to bring or develop the both personal growth and growth of the employees and professional growth among the employees. Then second is delivery of or rendering the high quality of healthcare services to the public or to the citizen. Third one is development of staff to their highest potential. So the maximum functioning of the staff, the optimum potential or strength of the staff has to be developed through supervisions. So the third goal is development of staff to their highest potential or maximum potential or strength, both in knowledge and skill. Then third one is to interpret the policies of the institution or organization, objectives and need for the employees. So to make sure the employees what are the policies, what are the objectives and what are the needs of the institution or organization. Then fifth one is to plan services cooperatively and develop coordination among the employees. That is work as a team with the team spirit. So the fifth goal is to plan services cooperatively between the workers and develop coordination among the workers. The sixth goal is to assist the workers in problem solving. So to assist the workers in different problem solving. And seventh goal is to develop and maintain standards of services. So there are set standards of nursing care services that has to be maintained and that has to be developed among the workers or employees or health personnel. So to develop and maintain the standards of services or works or activities. Last one is to evaluate. That is to evaluate the services which is done or given by the employees. So to evaluate the services done or given by the employees. So these are the important 8 goals of supervision. Next is objectives of supervision. So there are many objectives of supervision based on the goals. There are 8 important objectives of supervision, that is help the staff to do the job skillfully and effectively. So supervisor has to help all the employees or staff to do their job both skillfully and effectively. Then second is help the staff to develop the individual capacity. So each employee has to develop its own maximum capacity. Then only they can render the quality and effective health services. So it is the responsibility of the supervisor to help the staff to develop the individual capacity or highest capacity. Then third one is help the staff to meet the predetermined work objectives or goals of the institution or organization. So helps to meet predetermined work objectives. Then fourth one is help the staff to promote the cost effectiveness, health economics. So reduce the cost and increase the effectiveness or outcome or result of the services. So help the staff to promote the cost effectiveness. Then help the staff to get motivated. So motivate all the staffs by the supervisor and help the staff to get motivated herself or themselves. The sixth objective is help the staff to identify various problems that come across during the services and to solve them. That means employees are themselves identify the problems which come across during their activities of normal function and they themselves solve the problems. Thus it is another objective the supervisor has to help the staff to identify various problems and help them to solve by themselves. Then seventh objective is help the staff to develop team spirit. So community health services is rendered by community health team. So all the services could be rendered by team only. So there should be a team spirit and teamwork. So help the staff to develop the team spirit and promote the teamwork to get the effective result or outcome of the service. So help the staff to develop team spirit and promote teamwork. And last objective is help the staff to improve their attitude, positive attitude towards the work and towards to accomplish the objectives of the organization. That is, help the staff to improve the attitude towards the work and towards the vision and mission of the organization. Thus, help the staff to improve their attitude, that is positive attitude towards the work. So, these are the 8 important objectives of supervision. The next session is types of supervision. Supervision can be classified according to the direction of supervision and according to the type of action or type of services. So supervision can be categorized or can be classified into according to the direction of supervision, how the supervisor will supervise the employees, and according to the type of action or type of services or functions which are required from the employees. Thus, the types of supervision can be classified according to the direction and according to the type of action. According to the direction of supervision, there are 2 types of supervision, that is direct supervision and indirect supervision. Direct supervision and indirect supervision. According to the types of action or services, there are mainly 3 types, that is administrative supervision, clinical supervision and supportive supervision. Administrative supervision, clinical or educational supervision and supportive supervision. Let us discuss in short about the types of supervision. So the first type is according to the direction of supervisions. According to the direction of supervision, there are 2 types of supervision, that is direct supervision and indirect supervision. As the term indicated, direct supervision means the supervision is done by the supervisor through face-to-face talk with the employees or workers. So direct supervision is, that is supervision done by the supervisor with the face-to-face talk or communication with the employees. So supervisor observe directly to the supervisor when he does the activities. Then second type is indirect supervision. So indirect supervision is done with the indirect observation, that is it is done with the help of record and reports of the workers and through written instruction of the employee, like his diary, that is staff diary or health personnel diaries, and through some other agency between the supervisor and the supervisee. That means indirect supervision is done by indirect observation, either observing the record and reports that is maintained by the personnel or workers. Then through their written instructions, that is personnel diary, clinical diary, that is written instructions or any other reports. Then through some other agency. So some of the organization institution is supervision is done by the external agency, other people, the third party. So through some other agency or external agency between the supervisor and supervisee. This is about the indirect supervision. So first type is according to direction of supervision. There are 2 types, that is direct supervision and indirect supervision. The second type is according to type of actions or type of services of the employees. Supervision can be classified into administrative supervision, clinical supervision and supportive supervision. Clinical supervision is also called as educational supervision. So according to the type of action or type of services, there are 3 types of supervision, that is administrative, clinical or educative and supportive supervision. The most basic functions of administrative supervision is to ensure the administration work is performed in the organization or institutions. Most of the social workers or the health workers receive the administrative supervision at their agency or at their institutions. Clinical supervision is done by either in the clinics or health institution, that is at PHC, at sub-center, and even community health center, etc. And even in the during the home visit, like a supervisory home visiting. Supportive supervision is helps the supervisor to enhance the quality and the skill and knowledge of the employee to solve the problem. So here supervisor support the employees to develop his personal and professional growth. Such type of supervision comes under supportive supervision. In short, type of supervision can be mainly classified into or categorized into according to the direction and according to the type of actions or services. According to the direction, direct supervision and indirect supervision. Direct supervision is done by face-to-face talk or communication with the employees, and indirect supervision is done by through the verification or observation of the records and reports of the employee, is diary, that is personal or staff diary, and other personal record or report of the employee, and through external agency or third party agency who supervise the employees. According to the type of actions or services, administrative supervision, clinical or educational supervision, and supportive supervision. So these are the types of supervision. The next session is methods of supervision. So there are mainly 6 important methods in supervision. That means a supervisor can use different methods in supervision and different type of supervisions. So the methods can be categorized into 3 major groups, such as cooperative versus authoritarian supervision, technical versus creative supervision, and scientific versus intuitive supervision. So there are 6 important different methods in supervision. A supervisor can include in different type of supervision. These methods can be categorized into 3 major groups, such as cooperative versus authoritarian supervision, technical versus creative supervision, and scientific versus intuitive supervision. Let us discuss in detail about the different methods of supervision. The first category is cooperative versus authoritarian supervision. The first method is cooperative supervision. In cooperative supervision, there is a full participation among the employees or workers. So there is a full participation of each member of the group in planning, implementing, and making various decisions in the work settings or during activities. So in cooperative supervision method, supervisor give complete participation or full participation to the employees or workers, both in planning and implementing various programs in the work setting, and even the employees or workers are involving in various decision making in the work settings. So this is about the cooperative supervision method. Authoritarian supervision method is just opposite to the cooperative supervision method. Here the supervisor will be authoritarian. Thus in authoritarian supervision, the responsibility centered or entirely vested on the supervisor, and the subordinators has to follow his order or his words. So authoritarian supervision is opposite of the cooperative supervision. In authoritarian supervision, the responsibility is completely vested, or the center of supervision is supervisor only. Here is no complete participation from the part of the employees or responsibility in planning, implementing, and decision making. They have to follow according to the order and command of the supervisor. This is about the authoritarian supervision. Next is technical versus creative supervision. Technical versus creative supervision. In technical method of supervision, some of the basic supervisory skills need to be trained by the employees or workers to render the services. So in technical method of supervision, the employees or worker has to learn some basic supervisory skills that has to be trained by the supervisor. Example, through group conference and group discussions, employees are trained for different technical methods to be adapted or render in their work situation. Next method is creative supervision. Creative supervision method is just opposite to the technical supervision method. In creative supervision methods, the employees or groups provides the maximum opportunity or adaptation of the situation and initiativeness from the subordinates. So all the initiativeness from the subordinates are welcomed in a creative supervision. So they can have their own creative nature. They can develop their creative nature to solve the problems and plan and implement the various activities in the work settings. Thus, creative supervision provides maximum adaptation of the situation or maximum opportunity to the workers or employees. It also welcomes or accepts the initiativeness of the each employees or subordinates in planning, implementing and making various decisions in the work settings. The last type is scientific versus intuitive supervision. In scientific supervision methods, it is relies on the objective study and objective measurement than the personal judgment or opinion of the supervisor. So, supervisor always use the evaluation format, systematic methods of evaluation with the evaluation format to evaluate the performance or activities of the employees. So that's what it is called as scientific supervision method. So example is use of evaluation format to supervise the activities of the employees. That means this supervision is based on scientific or systematic method. The last one is intuitive supervision method. This is just opposite to the scientific supervision method. Intuitive supervision needs to be maintaining the good interpersonal relationship between the or among the employees and that is supervised and supervisor and supervisor and supervisee, and this relies on the personal judgment or opinion of the supervisor. Here supervisor personally judge the or supervise the employees by making a good interpersonal relationship and good rapport. So example is use of good human relation between the or among the workers or employees and have a good rapport. Through this supervisor can evaluate the employees or workers in work settings. So intuitive supervision relies on the personal judgment and opinion of the supervisor. Here there is no use of the systematic or scientific methods or format to supervise the employees. So far we have discussed 6 different methods of supervision that was categorized into 3 major groups such as cooperative versus authoritarian, technical versus creative supervision, and scientific supervision versus intuitive supervision. So authoritarian supervision is just opposite to the cooperative supervision, and creative supervision is just opposite to the technical supervision, and intuitive supervision is just opposite to the scientific supervision. So these are the difference between cooperative supervision and authoritarian supervision, technical supervision and creative supervision, and scientific supervision and intuitive supervision. Next is the techniques of supervision, different techniques of supervision. So techniques of supervision is based on 3 stages of supervision. So technique of supervision includes 3 stages, or technique of supervision means 3 stages: stage 1, stage 2 and stage 3. Stage 1 is pre-supervision, that is preparation for supervision. Stage 2 is doing the supervision, that is implementation of the supervision. And the last stage 3 is follow-up of supervision after the supervision, that is post-supervision. So technique of supervision is classified into 3 stages: pre-supervision, supervision and post-supervision, or preparation for supervision, supervision and follow-up of supervision. Let us discuss in short about the techniques of supervision. First stage is preparation for supervision. Here supervisor will study the various documents of the organization or institution, its vision, mission, different policies, rules and regulations, terms and conditions, objectives, goals and targets, and certain strategies or activities. Then second is identification of the priority area of job and activities for supervision. That is identification of the prioritized job activities for supervision. Then preparation of the supervision schedule. That is when, where, what, how, who has to be do the activities to fulfill the objectives or goals. So the first stage, preparation for supervision, includes a study of the documents, identification of the priority for supervision, and preparation of the supervision schedule, which includes a job list or job schedule of all the employees or workers. That includes when, what, where, how, who has to be do certain activities in the job setting. Second stage of technique of supervision is supervision, doing the supervision. For that, establishing good contact with the employees or workers. So establishing good personal interpersonal relationship and human relation and contacts. Review the objectives, targets and norms of the organization. So once again go through the objectives of the the particular department or section or organization or institution, their targets and various norms, that is rules, regulations, policies, etc. Then review the job description of the each workers or employees for the supervision. Review of the job description or various activities or functions of the different employees or workers. Then observe the staff's motivation, interaction, participation, cooperation, etc. So observation of staff's motivation or help the staff to get motivated. Then the last is observe any actual, that is a present conflicts or any future potential conflicts among the employees or workers. If so, solve the conflicts or problems or dispute between or among the employees. So these are the techniques during supervision. Establishing good contact between the or among the workers or employees. Review the objectives, targets and norms or policies. Review the job description of each employee or worker. Observe the staff motivation, cooperation, participation and interaction. Then observe any actual or potential conflicts, problems or dispute between the or among the employees and solve the particular problems or disputes. This is the technique of supervision in the second stage. Last is the third stage, stage 3, that is follow-up of supervision or post-supervision stage. Here, reorganization of the timetable or supervision schedule, that is work plan or duty roster of the different employees or workers. So, reorganization of the timetable, schedule, work plan and duty roster. Then organizing various programs to update the knowledge and skill of the employees, that is in-service education program, continuing nursing education program, continuous medical education program, etc. So organizing IEP or CNE, that is in-service education or training programs, continuous nursing education programs for the nursing personnel or health workers or employees to update their knowledge and skill. Then initiating the changes in logistic support and supply system, equipment supplies of the organization to render the quality based services. So initiate the changes based on the supervision has been done in the post supervision stage. That is another technique. In logistic support means that is support from the management in the flexibility in the rules and regulations, and support from the management for the supply systems, supplies and equipments which is needed for the employees or workers to render the quality services. So that is to get the financial support or budget from the management in relation to change the supply system or equipment and other needed articles. Then initiating the actions for organizing staff welfare activities. So staff development program, staff welfare activities to motivate the staff to achieve the ultimate, the maximum result for the organization. So initiate the action for organizing and conducting various staff welfare activities. The last one is counseling and guidance regarding the career development and the professional growth of the staff or employees. So counseling and guidance of the employees or workers regarding career development, professional development and professional growth of the each and every employees in the organization. So these are the different techniques used in the follow-up of supervisions. So technique of supervision includes the first stage, second stage and third stage, that is pre-planned stage, supervision stage and post-supervision stage. Next is the tools of supervision. Various tools can be used for supervision by the supervisor, like observation is a tool, direct observation or indirect observation. Then interviewing and questioning with the different structured and semi-structured questionnaire. So interview of the employees and questioning of the employees with various questionnaire, structured and semi-structured or non-structured questionnaire. Then conducting periodical conference for the employees, that is individual and group conference. The fourth tool is performance appraisal. So monitor the performance of each employee or worker with the performance appraisal format, or evaluation of the employees with the evaluation format. Then verbal and written reports of the employees. So that is another tool for supervision, that is verbal reports and written reports of the documents of the employees. Then orientation program for the employees and guided experience to improve the skill and knowledge of the employees. So orientation and guided experience. So orientation program, induction program at the beginning to get the orientation of the workers or employees in relation to the activities or functions of that particular organization or institution. Then manuals and protocols. So procedure manuals and protocols is another tool for supervision to supervise the work of the different employees or workers and others. So the important tools for supervision, there are 7 important tools, and we have many other tools also can be used by the supervisor in supervision. So observation, interview, questioning, individual and group conferences, performance appraisal or evaluation by evaluation format, verbal reports and written reports or documents, records and reports of the employees, orientation and guided experience of the employees, manuals and protocols and others. Let us see what are the other type of or tools for supervision. So other tools of supervision include checklist, rating scales, written policies and rules and regulations, anecdotal records, follow-up visit and evaluation of the employees or workers, staff meeting, periodically conducting staff meeting, then in-service education, continuous education, etc. These are the different type of tools can be used for the supervisor in supervision process. Next is the steps of supervision. There are mainly 8 important steps in supervision. So let us see what are the steps of supervision. First step of supervision is define the job for supervision. So define the activity or services of each and every employee for the supervision. So define the job. Then selecting and organizing various activities or functions of the different categories of employees. Selecting and organizing the activities, functions or services. Then third one is anticipating the difficulties which occur during the supervision. Anticipating means seeing in advance, foreseeing the difficulty or problem can be arise in relation to the supervision or during the supervision of the employees. That is anticipating difficulties. And fourth step is establishing evaluation criteria for the evaluation of the work of the employees. That is preparation of evaluation criteria. Then fifth is selecting the different evaluation methods for the evaluation of the employees. Selecting methods of evaluation. Then sixth step is execution of the different methods for the evaluation. And seventh one is evaluation of the employees or workers. And last one is after the evaluation, budget request from the management or top level management to make a modifications or the change that is required in relation to the supply and equipment system to render the quality services to the public by the employees or workers. So that is budget request. So these are the 8 steps of supervision. Define the job, selecting and organizing activities, anticipating the difficulties, establishing various evaluation criteria, selecting the different methods of evaluation, execution of methods, evaluation of the employees, and budget request from the top level management to change the supply and equipment to render the quality based services. So thanks for watching. So far we have discussed about the part 1 supervision video, except the principles of supervision that I have already uploaded as a mnemonic for principles of supervision as a separate video. And hope this video really benefits in your studies and exams. So if you feel it is worth and beneficial, please like, share and subscribe my channel. And once again, don't forget to subscribe my channel. So stay tuned with the Angel Health Academy for the second and third part of the video of supervision. Thank you.